So, why aren't more women being offered hormone replacement? That's the question today. And before we unpack this, I want to talk about the many benefits. I think when we think of menopause, not just we, I think we in general, society, just the average population, you toss out the word menopause and the first thing we think of is hot flashes, right? That's the immediate symptom that many of us do face when hormones are depleted. And that is part of what's happening. It's the obvious, right? We miss a period for a year, which is you know, that's definitely the measuring stick. And we might be waking up with hot flashes, or in some cases, we're having, sweats during the day as well. So that's all we know. That's all we know, and it's all we're told. That's really what's generally spoken about menopause. And so I think this is why hormone replacement, which does solve that symptom along with many others, which I will dive into, I think it's just lost in translation, just based on it's just that one symptom. Some women have it, some women have hot flashes more or less. So, unless you are suffering and unless you are with a doctor that knows all the benefits, then this topic generally doesn't come up. And this is something I'm so passionate about. I have learned more and more and more, not only since I've been on hormone replacement myself, but I think it's forced me to reflect back on what I never knew about menopause and the solutions to feeling better and long-term solutions to feeling better as women. And then we tap on diabetes, which is something I live with as well, type 1, 43 plus years now. And then we're told, okay, insulin's going to be a little harder to manage, or I should say blood sugar. Insulin's just going to have to keep going up. It's just part of aging. Get used to it. There's nothing we can do about it. Well, let me tell you, there are things we can do about it. And I think if more and more women had this conversation with their doctor and were offered this alternative, that we would be saving a lot of suffering. And again, today we're going to focus on the diabetes community because that's what we do here on the show. And I want to start off with the benefits. So again, it's more than just night sweats. It's more than just hot flashes. Here are just some of the benefits. And this is a short list because there's many, 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 many. I've written articles and I've done many social posts about this. It shocks people. And again, I don't create the information. This is information that is out there. There are many amazing researchers and hormone specialists that are doing this, that are finding out all of this, gathering the information from their patients and themselves, really, and coming up with this because there's a lot lost in translation unless we ask, right? So today we're going to talk about that. So these are just some of the things that here's some benefits for women with type 1 diabetes. Number one, it improves insulin sensitivity because I don't know about you, but if you live with type 1 and you've gone through hormonal stages, and this is even if you're in your reproductive years, again, I was clueless during my days, in my 20s and 30s, and even my 40s when I was still having a monthly cycle, how my hormone levels throughout my cycle were impacting my blood sugar. I was clueless. Doctors didn't point to it. It never came up. I never put it together, never tied it together. So estradiol, which is part of that hormone replacement formula, that secret sauce that that your doctor can prescribe for you, and we'll get into more of that here in just a minute. But insulin sensitivity is a powerful benefit that we do experience. Another thing it does, this is hormone replacement, is prevents muscle loss and weight gain. Again, we can hold on to more muscle because we know muscle is a metabolic driver of everything. So the more muscle we have, the more insulin sensitive we are. And the more insulin sensitive we are, or using less insulin, we generally do not gain weight. Again, this is a general statement. Again, there's different different situations for different women. Hormone replacement supports brain health and our mood. So it makes us feel happier, makes us feel more positive. We need that when we are managing type 1 diabetes or any type of diabetes. It reduces long-term diabetes complications. Again, when our body is less inflamed, because estradiol does help with inflammation. So if we have some estrogen on board, it's going to reduce inflammation. It's going to cause that radical effect that all of that has as we're also managing diabetes. So those are just a couple of the things. There's so many other side effects and symptoms that come along when our hormones get low and depleted that I don't think I could mention them all here in the show. I mean, I would just be sitting here for a half hour just giving you a list because there are known, I'll say that again, there are over 100 known symptoms. Isn't that incredible? Some of them get missed. They get blamed on something else. There's another cause to it. But bottom line, when we are aging, we are also living with a inflammatory disease like diabetes. Those symptoms they escalate. They get so much worse. And guess what, ladies? There are things we can do about this. So why is this conversation missing? Okay, so many women never hear about HRT. So again, hormone replacement, bioidentical. There's lots of different little terms out there. If you look on social media, amazing podcasts, but basically it's bioidentical, similar to what your body already produces. This is something we can get our hands on and to help us. So if we don't ask, then the doctors don't generally bring it up. They may be aware of options like this, but they don't necessarily suggest it. They do, and they don't initiate the discussion either. So sometimes due to, again, outdated beliefs, fears based around what, in this case, estrogen can do to our health. I mean, I'll say it. It's no misnamed. The mistake has been made that breast cancer is caused by hormones. That estrogen causes hormones. I should say that estrogen causes breast cancer. That statement is simply not true. And I'm going to share something more about that here in just a minute. But again, back to the doctors. There's this perceived patient risk. So again, doctors, they sign an oath, do no harm. They have been in this case is not taught about the benefits of hormone replacement with all the new research that's happening. So if you don't know, you don't share. If you don't share, you don't bring it up. You don't suggest it to your patients. So it just gets missed in the conversation. So the result, women miss these options. That could change. Trust me, they could change long-term health if we knew about this option to bring in to our protocol as we're aging. And unfortunately, endos, they know the importance, or few endos know the importance of HRT with our long-term blood sugar goals. They don't see the correlation. They don't understand really, many of them. I'm sure there's definitely some exceptions to the rule here, but many of them don't understand how all these hormones really do bounce off one another and how insulin really does need some estrogen in the mix of the hormonal puzzle in order to work its best, bottom line. Not to mention the mental load the low hormones have on us as women. So, you think about the physical effects of menopause and you think about how that affects us, but think about how that affects us emotionally. We're already dealing with a disease that takes a lot of mental, emotional, physical time and energy. And then when hormones are dropping, even as early as our 40s, we're starting to feel the effects, and it's only compounding what we're already dealing with, again, physically and emotionally alongside diabetes. So it just stacks up and we don't need to be there. This is just so unnecessary. And it makes managing this disease so much harder. I want to give you a real life example, and that's my mom. I remember, again, she was in her mid 40s. I was still living at home. I was right before I had left home to marry my first husband at the time. And I remember it was prescribed, she was having the hot flashes. And again, that's all I knew. That was my only correlation with menopause is that your period stops, you might get hot flashes. That's all I knew. That's all we were told. That was the only awareness I had. I think it was the only awareness my mother had. Her doctor at the time did put her on birth control. I remember her talking to me about this, and this was not something we talked a lot about. There was one conversation, it might have lasted 1 minute, 2 minutes, and she just explained what the doctor gave her to help her with her night sweats, basically. They ended up putting her back on birth control, which, again, that is another thing that many doctors are doing, again, because they're not familiar with the bioidentical, the good forms of hormone replacement. So they just put you on this synthetic version, which is what the birth control pills are. And so she was on that. Again, I don't remember the year. I want to say it was probably the mid 80s, might have been early 90s when all of this was starting to happen. But she was never offered bioidentical hormones. And I didn't know, I think this is one of the things that frustrates me now when I look back. And again, I was just in my early 20s. I was just a young girl. I knew nothing about, obviously, hormones, menopause, anything. And again, I can't change what I didn't know at the time, but she suffered. She suffered because it wasn't available. It wasn't made available to her. So fast forward when the WHI study came out, that was in 2002, she was taken off the birth control. Again, her, like many women, because of the fear was put out there that it may cause complications, blood clots, breast cancer, all the things, the fear just caused doctors to say, I want you off of these birth control pills. So she went off the pills. And again, it wasn't much of a conversation back in those days. I just kind of remember it. I was kind of the outside witness, but not really involved with really how this was impacting my mother or was going to continue to impact my mother. So my mother is now 80, 81. She just had her 81st birthday. And now I'm more aware in the last 6, 7 years since I went back to school and studied this and hormone health and experienced it myself, a woman in menopause. I know the impact of what she didn't have in her 50s, 60s, and 70s, that loss of hormones in her system to help fortify bone health, to keep her cardiovascularly stronger. She's always been borderline type 2 diabetes. I've checked her blood sugar over the years just to kind of give her some feedback on that. So I know that's part of the puzzle too, because again, we become more insulin resistant and she does not live with type 1. Is not diagnosed with anything like that. But again, it's another indicator of another marker that shows up when we have very low levels of hormones in our body as we're aging. So she's a really good example. And it is interesting how I can reflect back on what I knew at the time, but had no real language or help to really give her, to offer her. So it's sad to say that we're at the point now at her age that it's really too late. And again, she could go to her doctor. I've encouraged her to look into that to find out more. So at her age, is it too late for her to be on some sort of bioidentical hormones? Again, stay tuned on that because that is something I'm still having the conversation around with her and encouraging her to do that. So within the past 7, 8 years, she has fallen twice. She had a shoulder fracture. She fell and it was a hand. It was actually her forearm. That's what it was. So she's had shoulder injury. She's had a forearm injury, fractures, not breaks. So that's the good news. But again, it took a lot of time to heal. Again, the whole idea of why her bones were weak, why she was at risk, it just never came up, and it still has never came up. And I'm thankful that I can have these conversations with my mother to help educate her and to reflect back. And it's one of those, it's kind of a touchy subject because I don't want her to feel guilty about what she didn't ask for, say 20, 30 years ago, or insist on being prescribed in order to prevent this pain and suffering that she has just recently went through. So it's a touchy subject. It's not something that I stress or I point to too much because I don't want her to feel really worse about the situation, than I want her to. So that's definitely part of the story with my mother and myself. And I don't know about you, and I think it's because I'm so much more in tune now with just this time of our life and the benefits of hormone replacement. I am meeting countless women, and these are friends in my friend circle, women I go to church with, just, because I'm in my late 50s, so I'm meeting more and more women my age. We go to high school class reunions, and I'm meeting women in their mid to late 50s. And in a conversation will come up about how you're feeling, what's going on. Hormones pop into the conversation, menopause, and the lack of understanding of this being an option for them so that they don't have to have the stubborn ways, that they don't have to be scared about a type 2 diabetes diagnosis, that they don't need to be on a statin because their cholesterol numbers are going up. All those things, or that their bone density is starting to show weak and osteopenia has been a diagnosis for them. Again, these are all signs. These are all things that can be prevented if we are proactive with our approach with what we put back into our bodies. And that is healing, fortifying, wonderful hormones. Again, if you haven't noticed, I am a big advocate. And I'm just on a mission because I want to have this conversation, not only here with you on this show, but within my friends, within my church family, within everybody I run into who happens to be my age or is coming up on my age. I'm meeting more and more younger women in their 30s, late 30s and 40s. Again, some with diabetes, some without. But I really am trying to open up this conversation so that they are educated, so they can go back to their doctor and have this conversation so they know their options. Number one, that they know the benefits of hormones. Number two, that they have a voice about what they can do and what they can request from their doctor. And again, if it's not happening with their doctor, they can move on and find somebody that's willing to have that conversation. And women with type 1 diabetes and HRT, this is another thing too. And many with type 1 are told HRT, hormone replacement, is too risky. Again, we got enough going on. We're balancing it up with our health. We don't want to add hormones to the mix and increase our risks. But we have to have the benefit risk conversation because I don't know about you, but again, once I have learned and understood all the benefits and really the overall low risk of what estrogen is going to do within our body and our other symptoms in our body, I am more than willing to take any amount of little risk. Again, it's very minute because my life, my sanity, my diabetes management, it needs all the help it can get. And I am willing and able to supplement and bring on those hormones now and until I leave this earth. So I'm really thankful that I have not only the practitioner and all the things going for me in order to keep this going. And I enjoy being able to share this with you as well. Because we want to talk about as well, like just to reiterate, it's not just the physical and the medical benefits of hormones, it's the emotional. We are going through so much living with a chronic disease and low hormone levels. It affects our mood, our energy, our ability to get up and go, our wherewithal. It affects our relationships. It affects our families. It affects our careers. It affects our faith. It affects our relationship with our disease, living and trying to stay vital and to thrive and to keep going and to push through. And we need all the help you can get. And you think the only thing I regret now that I've been on bioidentical hormones for about 6 years now is not starting sooner. And that's because I never had the conversation earlier than that with my own practitioner. So again, this was not something that came up in an OBGYN visit for me. I had to bring it up. I had to come in and say, hey, this is something I want to look into. This is something I know is going to benefit my life with diabetes, my blood sugar control, and long-term health and longevity. And I had to open up that conversation with them, and they were receptive, thankfully. And then We proceeded with getting my tests done, prescribing the dose, and, the rest is kind of history and where I am right now. But I was willing to do that. And I was so happy that I had the wherewithal to have that conversation. And that's what I do as a coach. So number one thing I do inside of our inside our type 1 and midlife coaching circle, this is what we do. We talk about this. It's the conversation. It's how we're feeling. It's how to advocate for what we want to bring into our life to help with our life and our health and our just the way we want to manage this. And that is what we do. I come in as a coach and as a group, we wrap our arms around each other and we're sharing and we're encouraging and we're finding solutions to take that step. And not everybody decides to get on hormone replacement. And that is a very personal decision. But I think what's most important is that you understand the benefits and you can make that decision for yourself. So let's talk about the WHI study. So just to recap, this might be something that you're aware of if you're in the space online, especially. Menopause is quite a movement right now. I'm really excited to be able to bring the awareness right here to our community because it's important. Like I've said, very important. So the fear, the uncertainty, and the outdated science, basically. Back in the impact of the 2002 WHI, so that's the Women's Health Initiative. That's what that stands for. And that was the short, or the myth, I should say. I'm not sure where I got the name short there, but the myth versus the fact. So the myth was, after they concluded that study, again in 2002, that that HRT, so the WHI proved HRT is dangerous. So again, the myth is that this study in 2002 proved that hormone replacement therapy was dangerous. The fact, the risks were small, and the study itself was applied to older women. So it was an older segment of the population that started late. They were in their mid to, it was right like 64, I think was the average age of the women that were studied. And the estrogen alone lowered breast cancer risk. So that's what was the fact that they found. Another thing to consider is that the hormones they were using in this study were the synthetic versions. So again, it was the progestins and it came from horses' urine. So again, I don't know all the facts in front of me, but that basically is what it is. But it was misinformation. It was really a poor study based on all of the criteria that they used and the women that they studied and all of that, and not to mention the type of hormones that they were testing this theory around. But the horror stories, it kept women from exploring HRT. And like I was saying, my own mother, who was on the synthetic version, was taken off. So she was getting some benefits even from the synthetic version, but she was removed from it, again, based on what the doctors were now being told, what the public was now being told. And it was just a sweep all across the population of women who had been on hormone replacement and were now taken off. And that just did an amazing disservice to the women, the community of women. And again, we're talking generally here about women in our society. So I'm not going deeply into the population of women with type 1 diabetes, but it doesn't matter. This is all women. But just think about how, when we know about all these benefits of hormone replacement, if we are told one day that, oh, you're doing great. Your estradiol, progesterone, testosterone, that's been an amazing formula for you for years. And for somebody to now tell me, no, we found that to be dangerous, my doctor to say, you can't have that anymore. Taking away from me, it's like taking my insulin away because that's a hormone I need too. So you can't tell me my body, what is thriving on what it needs, can no longer have it, and that I'm just going to have to deal with the consequences. That is unacceptable. So fear. Oh, and this is another thing. Why we avoid what we don't understand. I think that is really where the conversation is. So when I meet women and I mention that I'm on hormone replacement, or I inquire, it's a gentle conversation. I don't just barge in and ask a bunch of questions about people's personal health. But if it comes up naturally, And just letting them know that this is an option, they never knew it was an option. They're like, "Oh, my doctor never told me about that. I didn't know anything about it." Wow, and they feel shocked, they're shocked. They're confused. They really thought it wasn't even something they could talk about or ask or insist on. But that fear plus the silence, like I just mentioned, it ends up being inaction. So if you don't know about it, or if you have a fear of what it could do to you, in this case, the fear of breast cancer, which has been dismissed, then you avoid it. I mean, that's human nature, right? And if women don't understand hormone replacements, we won't ask for it, and doctors may not bring it up. So again, empower yourself, learn, and feel the benefits, get the benefits. And, it's important to have that informed choice, okay? And there's so many different avenues you can take. The book Estrogen Matters is an amazing resource. So if you're still not convinced of really the role of estrogen in the body, I highly recommend you check out that book. And Dr. Mary Claire Haver, she's an amazing writer. She's writing really, really good guide books on this, is going to just kind of walk you through the benefits and the different types of hormones and how to talk or find a practitioner that can lead you down the right road. But definitely don't just stand and avoid. I really do encourage you to ask questions. And if you're curious and if this is a route you want to take, to definitely reach out and to learn more. So if you're in perimenopause or postmenopause and noticing changes in your blood sugar, it might be time to explore hormone replacement. It definitely does make a difference. And we talked about bone density and we talked about energy and we talked about just having a metabolic system that is working well. We need that, don't we? Hormone replacement is going to give you that addition. It's going to help support those systems because when we still have to get up every day, dial the insulin, get the workout in, eat a balanced meal, again, within reason, the 80-20 rule is what we apply and keep a good night's sleep, right? Don't forget about the sleep. We need a good night's sleep. All that's going to support life with diabetes and aging with diabetes. And we need to pursue that. And my book, which is coming out, will have a lot more information to support you and your decisions around hormone replacement. Understanding your body throughout the cycles and this natural transition. It will offer step-by-step guidance on what you can do. And just a teaser, the sooner the better. Like I said, I would have jumped on hormone replacement a lot sooner, probably in my mid 40s. Again, maybe 10 years sooner if I had known the benefits and what it would have done to kind of curtail the suffering I was doing. And I haven't talked too much about all the different things I've had going on. I've had the frozen shoulder, I've had the vertigo, I've had the stubborn weight, I had the insulin resistance, I had the heavy periods that the only solution my doctor gave me was um, endometrial ablation. Okay, those are not, it worked. It definitely solved the problem at the kind of, it did help me, but I think in retrospect, if I had known more about really the state of my hormones in my early to mid 40s, if would have made a different decision and just chosen to start on hormone replacement, bring in a little progesterone to kind of mitigate what was happening in my overactive uterus at that point. Again, if I had known then what I know now, the journey would have been probably different. And before my book launches, it should be out in early 2026. That is the goal. You can get a free guide that I created that I wished I had in perimenopause. So I put this together just to kind of give you a little teaser. So it's the what, when, and how of hormone replacement. It's a trusted resource that covers everything I talked about today. You can download the guide and a chance to start the conversation with your doctor. So I help equip you about what to expect with with your body and what's going on. And I just kind of unpack hormone replacement and the different types and formulas that you can really, again, have this conversation with your doctor. So, and that's right here in the show notes. So you can download that, get the free guide, and it'll also that will get you on my weekly newsletter, and you can stay up to date on when the book will be out for sale, and you will have access to pre-ordering your copy of the book as well. So A lot of exciting things happening. If you can't tell, I'm very passionate about this topic. And I'm so thankful that, I'm thankful for the journey I had to go through to learn and to really, really kind of equip me to be this advocate because I know there's a reason and there's a purpose in what I experienced in order to help prevent and warn you about what's to come and to maybe shorten or eliminate your symptoms or your suffering. That's my goal is that you don't have to kind of experience what I had to experience because I didn't know what I know now sooner. So again, the book is going to help you with that. Download that free guide. That's going to help you with that. That'll get you a head start on that right now. And again, stay here in the circle. Share this episode with the lady that you know needs to hear it. And again, women, more women need to be aware and told about hormone replacement, especially those of us managing diabetes. So I'm so happy you were here today. I hope you found value in this. And until next week, have a beautiful, beautiful day. Bye for now.